So here we have the sternoclavicular joint dislocation, and what the injury is when the sternum, when the clavicle displaces at the distal end. As you can see in the bottom picture, I try to draw the dislocation, and there's other variations of the dislocation. The posterior dislocation, which is displayed as the least common. I believe it said only happens up to 3% out of all dislocations that happen. And so the I'm sorry, but the mechanism of injury, there's two types. So whenever it's like a direct like impact, it's when the force applied to the medial aspect of the clavicle and forces it posteriorly, as you can see in the picture below. And an example of it would be like if a athlete, so say in like a football game, and all like the players jump on one player and it ends up being a big pile, and or just when athletes fall on top of one another. And then indirect example or mechanism of injury would be when force applied to the shoulder and transmitted medially. And this would just be like falling on an outstretched arm. In evaluation, of course, you want to begin at the jugular notch and just feel around the SC joint. And stress test should not be performed on obvious deformities. So if it's obviously displaced, probably just have it go get x-rayed and send them to the hospital for sure, since this dislocation can be very severe whenever it posteriorly dislocates, since it can block off the subclavian artery, the trachea, and all other vital vessels and whatnot. And joint play will elicit pain for first, second, and third degree strains, and that will be marked by hypermobility.